My name is Ruchit Nagar. I'm the CEO at Khushi Baby, and the solution that we are proposing for MIT Solve's maternal and newborn track is called Khushi AI. Basically, what we are trying to do is we are trying to bring precision public health for the maternal and child health space. We want to be able to use the advances in data science to predict which pregnant women are at a higher likelihood of adverse delivery outcomes, which infants are more likely to be born at low birth weight and have adverse outcomes in their first month of life when they're at most risk. And really, the solution that we are proposing requires two pieces. Before you even get to the AI and machine learning model, we are doing a lot of work on refining the data quality itself. So, over the last 3 years, we've worked in rural Rajasthan, India, with around 30,000 beneficiaries, mothers and children that we've tracked in across 400 villages. And we've built an understanding of the patterns of how the frontline health workers actually enter data, how the data may be manipulated or changed, and how it may not actually reflect reality. And accordingly, we've come up with over 40 data quality checks that are rule-based checks, but that are also being supported through other kinds of statistical checks through our partnerships with Google AI for Social Good and with researchers at Singapore Management University. So the first part of our solution is really trying to put a weightage to each data point that we want to put through our statistical model. And that weightage is determined by our field expertise as well as the statistical feedback that tells us that yes, this data is actually trustworthy and to what degree. And this allows us to prevent garbage data from coming into the model, which will ultimately lead to garbage recommendations. We want each data point to be weighted by its level of trustworthiness, if you will. And then the second part of our solution is a little bit more conventional, where we use neural network algorithms to then predict specific health behavior outcomes as well as health outcomes. And what do we do with the output of this model? Specifically, we share prioritized due lists. So based off the ranking of this model, we can actually share due lists of mothers, of pregnant women to the frontline workers, so that way they know who are the top 10% of their cohort that they need to actually prioritize. So ultimately, the goal for us is to help the frontline nurse prioritize those mothers and infants that may be at higher risk than what they may perceive to be based off the health worker's own intuition. And we think that data science has a huge role to play in that. Moving forward, we are actually working as the nodal technical support partner to the Department of Medical Health and Family Welfare in Rajasthan. And we also will be able to use the models that we've applied for predicting malnutrition and other things to a much larger data set now of over 2.5 million mothers and infants that are tracked through Rajasthan's digital health system every year. So we're excited to pitch for this particular track for MIT Solve, and we think it's very important for us to all work together to address the very pressing issue of maternal and neonatal health. Thank you.